Welcome to iAdvocate, a podcast series on the public policy process developed by the Emergency Medical Services for Children National Resource Center. This series will equip you with information and strategies to effect legislative change at the federal, state, and local levels. While many of the examples used in this series refer to the federal policymaking process, most of the tools and tips are also applicable at the state and local levels. In addition to taking this training, we encourage you to download and view the Resource Center's Public Policy Primer, which will supplement the content discussed in this series. In the second lesson, you will learn about the rules of advocacy, including the difference between lobbying and educating and informing, as well as recommended guidelines for engaging in these activities. Since there are different implications for these two activities, it is important to understand the distinction between them. Freedom of speech is one of the foundations of our nation's government. This freedom provides citizens, interest groups, and other parties the right to petition and appeal to our government. Specifically, it allows us to lobby policymakers in favor of or against policies that we feel strongly about. It also allows us to ensure that our public officials are properly educated and informed when making policy decisions. Lobbying is perhaps the most well-known means of petitioning our government and influencing a policymaker's opinion. Lobbying is a series of actions intended to influence legislators or other government officials to support your cause. For example, you may ask a legislator to introduce a bill on a particular matter or to vote a specific way on a piece of legislation. There are two types of lobbying: direct and grassroots. Direct lobbying is any personal attempt you make to influence legislators. This may be done through written correspondence, telephone calls, an in-person meeting, or oral testimony before a committee or commission. Grassroots lobbying, on the other hand, involves encouraging others as a group to influence legislators. For example, professional organizations often ask their members to contact their policymakers in support of or against an issue. The goal is to indirectly affect public policies by raising awareness for a cause among the general public. Keep in mind that for an activity to be considered lobbying, you must state an opinion in support of or against legislative action. A request for additional funding for a program or agency would also meet the definition of lobbying. Simply providing factual information on an issue, however, is not typically considered lobbying. We will discuss this concept further in a few moments. There are several rules that govern advocacy activities, two of which are most important for federal grantees and other citizens. First and foremost, federal grantees are prohibited from using their grant dollars to lobby. They cannot lobby during work hours or use resources paid for with grant dollars, such as a computer or telephone, to support lobbying activities. Specifically, grantees may not use work time to meet with, call, or email policymakers or to develop or draft lobby-related materials. Even when lobbying on their personal time, grantees must ensure they do not identify themselves as acting, writing, or speaking on behalf of their grant program. To better explain this restriction, let's follow the example of a fictional EMSC program grantee, Peter Smith. Mr. Smith is employed by an academic medical center but spends 100% of his time working on grant activities. His salary is paid for solely by grant dollars. Therefore, he knows he cannot lobby during work days. He decides to lobby on his personal time by sending emails to his legislators asking them to support EMSC-related legislation. He considers writing draft emails on his work computer during his lunch hour. He remembers, though, that he cannot use resources paid for with grant dollars, such as his work computer, to support his lobbying activities. Instead, he waits until he is at home to draft and send the messages from his personal computer. He is careful not to mention his association with the grant or use his professional title. He simply states that he is a constituent of the legislator who is familiar with and concerned about EMSC. There is, however, an exception to this rule. Federal grantees may be able to lobby during work hours if their salaries are paid in part by non-grant funds. For example, if 20% of Mr. Smith's salary is paid for by his employer, then 20% of his work time may be used to lobby for the medical center. If lobbying under these conditions, he must clear his activities with his employer in advance and identify himself with the medical center, not with the EMSC program. In addition, he still may not use resources solely paid for by the grant dollars to support his activities. As just mentioned, the second rule of advocacy is that everyone must adhere to the employer's rules and limitations regarding advocating during work hours, if any exist. This holds true whether you are lobbying or simply sharing factual information with the legislator. Your employer may not only limit the use of your work-related time for advocating, but also the use of their resources. Let's look at a hypothetical example. Dr. Kathy Miller is an emergency department physician interested in advocating on behalf of EMSC. First, Dr. Miller consults with the hospital's Government or Public Affairs Division before talking to her lawmaker. She wants to determine if she can partake in any kind of advocacy during work hours or if these activities must take place on her personal time. She also asks if she can use hospital resources to assist her efforts. She would like to use the department copier to duplicate a fact sheet developed and branded by the hospital. The hospital's government affairs staff is pleased to learn of her interest. They advise her that it is okay to lobby during work hours and offer to provide her with the background and materials she needs. Since the hospital already has an organized lobbying effort underway, Dr. Miller must coordinate with their efforts. It is important that her activities and her message complement, not conflict, with that of the hospital. While it is imperative that you follow both the ban on lobbying with federal grant dollars as well as your employer's own limitations, these rules are not meant to bar your participation in the public policy process. If restrictions prevent you from lobbying through your employer, there are other ways to participate in advocacy efforts. First, if you are a member of a professional or interest-based organization, you may be able to lobby on behalf of that group. For those concerned about pediatric emergency care, you may be a member of the American Academy of Pediatrics, the Emergency Nurse Association, Family Voices, or the local or national Parent-Teacher Association. As mentioned previously, many such organizations have grassroots lobbying efforts in place directed towards their members. It is important, however, that you discuss your proposed activities with the group in advance to ensure that your activities and message comply with their priorities and practices. Also, remember that anything you do on behalf of the organization must be done using their name and resources and take place on your own time. You may not mention any federal grants you hold or your employer's name unless approved to do so in advance. Second, all citizens have the right to lobby on any legislation on their personal time. You must, however, only identify yourself as a constituent of the policymaker when communicating with him or her. Do not mention any affiliation with or use the resources of a federal grant program, your employer, or any other organization without permission. Finally, educating and informing your policymaker is an alternative to lobbying that does not involve a great deal of restrictions. It is an ideal option for those who cannot lobby or who do not feel comfortable lobbying. When educating and informing, you are simply providing factual information on a given topic. You are not asking a legislator to support a specific piece of legislation, endorse program funding, or vote a certain way. For example, you may provide background on an issue or explain how a particular government program works. You may present nonpartisan analysis or research. You may also share how an issue, problem, or program impacts your state or community, your work, or your personal life. This can be done not only by meeting with, calling, or emailing a legislator, but also by providing factual testimony before a legislative committee or commission if invited to do so. Remember, however, you are not expressing an opinion about any specific legislative initiative. Also, you should consult your employer if you plan to educate and inform your policymaker during work hours or on behalf of your employer. Thank you for joining us for this lesson of iAdvocate. To learn more about the concepts discussed in this lesson, please refer to the Public Policy Primer, a guide to the legislative process and impacting change at the federal, state, and local levels, available free for download from the National Resource Center's website. In the next lesson, you will learn about the importance of becoming an informed constituent and understand the most effective ways to communicating with your policymakers and their staff. including written and electronic communications or an in-person meeting.